to put self-interest in second place and the interest of humanity first, fortune, prosperity, and dignity will befall on you, as long as you uphold the virtue of your profession to the purest. Mahidol of Songkhla. Today, humanity is faced with numerous challenges, economically, socially, environmentally, to include those from pandemics and illnesses. All these are important factors that create impacts on security and well-being of humankind. In particular, when it comes to health issues from either communicable or non-communicable diseases, this is considered as one of the key concerns that many relevant professionals are continually working on to find ways to prevent and cure. In light of such situation, there are individuals and groups of people in the fields of medicine and public health who dedicate and sacrifice their lives, spending their tireless hours conducting studies and tests in countless times to discover ways and procedures for treatment and produce medicine to aid, protect, and treat the sick. His Majesty King Bhumibol Adulyadej the Great graciously granted the royal permission to establish the Prince Mahidol Award to honor His Royal Highness Prince Mahidol of Songkhla as Father of Modern Medicine and Public Health of Thailand, who dedicated his whole life for national development in many areas, including medicine and public health, building their strong foundations for advancement to be on par with modern nations today. The occasion was also to commemorate the centenary anniversary of the Prince's birth on January 1, 1992. The award is administered by the Prince Mahidol Award Foundation under the royal patronage, chaired by Her Royal Highness Princess Mahachakri Sirinthorn. The Prince Mahidol Award is conferred annually on individuals or institutions for outstanding and exemplary contributions to the benefits of humanity in the fields of medicine and public health. Each award consists of a medal, a certificate, and a cash prize. Since the establishment of the award in 1992 up to 2021, for the past 30 years, 90 individuals, groups of individuals, and institutions have been awarded. His Royal Highness Prince Mahidol of Songkhla was the son of His Majesty King Chulalongkorn and Her Majesty Queen Sawangwattana. He was born on January 1, 1892, and was also the father of two benevolent kings of Chakri dynasty, His Majesty King Anantamahidol and His Majesty King Bhumibol Adulyadej the Great, and Her Royal Highness Princess Kalyaniwattana. He is also the paternal grandfather of the present His Majesty King Mahawachiralongkorn Phra Wachiraklau Chao Yu Hua. For Prince Mahidol Award 2022, there was a total of 88 nominations from 34 countries considered. In the field of medicine, the award is conferred to Professor Dr. Ralph A. DiFranco, Professor of Medicine, Diabetes Division, University of Texas Health Science Center at San Antonio, Texas, United States of America. Professor Dr. DiFranco has persevered in studying the pathophysiology of type 2 diabetes, or T2D. He has helped to define that obesity, especially central obesity, cause the biochemical and molecular disturbances responsible for insulin resistance in T2D. Professor Dr. DiFranco also proposed the personalized treatment of T2D by choosing the appropriate medication according to the pathophysiology of diabetes. In addition, Professor Dr. DiFranco's work was further developed to involve the prevention of T2D. His exceptional achievement has saved many people from T2D and saved millions of T2D patients from chronic diabetic complications. In the field of public health, the award is conferred to Dr. Douglas R. Lowy, Deputy Director of National Cancer Institute, National Institutes of Health, Bethesda, United States of America. Dr. John T. Schiller, NIH Distinguished Investigator and Deputy Chief Laboratory of Cellular Oncology, National Cancer Institute, National Institutes of Health, Bethesda, United States of America. and Professor Ian H. Fraser, Emeritus Professor, University of Queensland, Brisbane, Australia, United Kingdom. Dr. Lowy and Dr. Schiller worked together at the National Cancer Institute and discovered that the major virion protein of human papillomaviruses, or HPV, could self-assemble into virus-like particles, or VLPs, and the VLPs could strongly induce a protective immune response against the viruses. Professor Fraser, working at the University of Queensland, discovered the VLP self-assembly process. These researchers then developed VLP production processes from recombinant proteins. This led to the development of HPV vaccines using VLPs, which are highly effective owing to the enhanced immunogenicity and the presentation of native antigenic epitopes to the immune system. The works of Dr. Lowy, Dr. Schiller, and Professor Fraser are the expansion from the earlier work of Professor Emeritus Harald Zuhausen from Germany, who received the Prince Mahidol Award in the field of public health in 2005 and the Nobel Prize in Medicine in 2008 on the discovery of human papillomavirus, which was the cause of cervical cancer. The discovery led to the development of an HPV vaccine, which was used worldwide, and also prevention of other HPV-related cancers, thus helped save countless lives. On Thursday, January the 26th, 2023, Her Royal Highness Princess Mahachakri Sirinthorn, as representative of His Majesty the King, confers the Prince Mahidol Award for the year 2022 in the field of medicine to Professor Dr. Ralph A. DeFronzo, and in the field of public health to Dr. Douglas R. Lowy, Dr. John T. Schiller, and Professor Ian H. Fraser, with the latter in absentia, with Dr. Angela Jane MacDonald, Australian Ambassador to Thailand, receiving the award on his behalf at Chakri Throne Hall in the Grand Palace. The award ceremony was broadcast live by Channel 9 MCOT HD, with signal relayed to other media channels. Following the award ceremony, Her Royal Highness Princess Mahachakri Sirinthorn graciously granted an audience for the laureates and spouses at Sommot Thewarat Upabat Hall.
Well, I think one of the very important things that I can recommend is that people try to maintain their body weight and to exercise on a regular basis. But we also need to understand that this is a genetic disease. And even though you maintain your body weight and you exercise, if you have the genetic background, at some point the diabetes is going to develop. And in this situation, it's very, very important that you be under the care of a physician. And over the years, we've developed, and I've been involved in the development of several really good drugs, so that if you will take the drugs on a regular basis, we can in large part prevent the complications.
Well, the HPV was shown actually by Professor Harald Zuhausen, who received the Prince Mahidol Award in 2005, and it was shown to be the principal cause of cervical cancer. And since cervical cancer is such an important problem, one of the most common cancers of women, especially in low and middle income countries, we thought that it would be important to try to develop a vaccine. We were not at all sure we would be successful, but fortunately, our efforts were successful.
It's been estimated that hundreds of thousands of future cancers have been prevented already by the vaccine. But it has the potential to prevent tens of millions if we can get more girls to be vaccinated. Currently, only about 15% of the world's girls are being vaccinated.
During their visit to Thailand, the laureates had opportunities to lay wreaths to pay respect to Prince Mahidol of Songkhla in front of his statue at Sirirat Hospital. They were also invited as special guest lecturers to address their research works and achievements to Thai medical and public health personnel, and to share their experiences and views at the Prince Mahidol Award Conference 2023, or PMAC 2023.
Very pleased to join you today at the Prince Mahidol Award Conference 2023 on the theme of setting a new health agenda at the nexus of climate change, environment, and biodiversity.
So there's this big cardio gas. So we've actually gone from a very glucose-centric with type 2 diabetes and now also type 1. Their big problem, if they don't go blind or end up on dialysis, they have heart attacks and strokes. So there's this big cardiovascular, and you're a cardiologist yourself, there's a big cardiovascular component to diabetes. So we actually have gone from a very glucose-centric disease, where we try to lower the glucose back into the normal range to prevent the eye, kidney, and nerve damage, that now we recognize if we want people to live longer, we need to protect them against the cardiovascular damage, the damage to the blood vessels. And we also know that all other organs are involved. The liver gets involved, as I said, eye, kidneys. So it's really a global problem.
Even to this day, there are no antivirals against this particular virus. It's a very hard virus to make antivirals. So it was worthwhile to pursue both in parallel, but the vaccine has worked spectacular, and we still don't have antivirals.
Okay. I would say that antivirals are very good for treatment, but you need to know somebody is infected, and you need to have an effective treatment, and you need to be able to give it to them. Whereas with a vaccine, you just need to vaccinate people and you're finished.
Good.
Moreover, the laureates were taken on a tour around the facility of Medicine Sirirat Hospital. They also paid a courtesy call on the Prime Minister of Thailand at the Government House. The great achievements of all laureates of the Prince Mahidol Award are commendable and exemplary of the works for the global community at large. They form guidelines for future study and researchers to make new discoveries on medicine and public health, providing tremendous benefits to healthcare development for humanity in the years to come.